Hello, I'm Dr. Anthony Gonzalez. I'm a general, robotic, and bariatric surgeon down here in South Florida. I'm born and raised in Miami, went to college at the University of Miami, and went to medical school at the University of Miami School of Medicine. I've been in private practice here in South Florida at Baptist Health since the late 1990s. I am the chief of surgery at Baptist Hospital in Miami. I run the bariatric surgical program as the medical director of the bariatric surgical program for Baptist Health. And I'm the founding program director of the Minimally Invasive and Bariatric Surgery Fellowship. That is a fellowship where surgeons spend a year with me after residency to learn advanced robotic and bariatric surgery. Today, my practice is 70% general surgery. General surgery involves conditions like hernia, gallbladder, reflux, and even colon surgery. And 30% of my practice is dedicated to bariatric surgery or weight loss surgery. All of these operations are done through minimally invasive robotic approaches as my experience as a robotic surgeon. Now, let's discuss a few common conditions that I deal with on a daily basis. Thank you. In this video, we're going to talk about lipomas and sebaceous cysts. What is a lipoma? A lipoma is a benign fatty tumor. It's a growth. It's a growth of fat. It's a tumor that'll grow. It's likely to be benign, and it grows under the skin. A sebaceous cyst is a sweat gland cyst. It's a cyst that grows in the skin. Many times, it's very hard to differentiate what is a lipoma versus a sebaceous cyst. But when I see you in the office, I can delineate and determine whether it's part of the skin or it's under the skin and it's a lipoma. Lipomas and sebaceous cysts can occur anywhere in the body, all over the arms, the chest, the back, anywhere. Now, the symptoms of lipomas and sebaceous cysts, sometimes they cause pain, sometimes they cause discomfort, and sometimes they can be disfiguring. Imagine you have a large mass on your arm. It's disfiguring. It looks ugly and obviously would not be something you would like. Now, the treatment for a lipoma and a sebaceous cyst depends on what it is. A sebaceous cyst can become infected, and a sebaceous cyst, when it becomes infected, it will be painful. And a painful and sebaceous cyst that's infected requires drainage in the office, and then it requires antibiotic therapy. The treatment for a sebaceous cyst that's not infected could be just observation. If you have a lipoma or a sebaceous cyst that is not causing pain, not causing discomfort, not causing disfigurement, we could just observe. If you don't like the lipoma, you don't like the sebaceous cyst, then surgery is what's going to be required to remove it. Surgery can be done in the office many times when they're small. If you have a very big lipoma, a very big sebaceous cyst, we may need to go to the operating room to remove it. But if they're small, like many of them are, we do them in the office. And these are office procedures with you completely awake. We give you some local anesthesia in the area. We remove the cyst or the lipoma, a few-minute procedure, and you walk right out of the office. If they're very large and they cannot be done in the office, then it requires you to go to the operating room. You'll be sedated by vein with an IV, and then we will remove the cyst or the lipoma in the operating room setting, and you'll be taken home by your family and friends. The recovery of these operations are very quick. If they're done in the office, you're recovering and you're going back to work or your school or whatever you need to do the same moment. If they're done in the hospital, you have to take the day off because you've been medicated, and then obviously the next day you can go back to your normal activities. Complications are very rare because these are clean procedures. They don't involve intestines. They don't involve any type of contaminated surgery. So complications of bleeding are rare. Infection is rare. So you can understand that these are very simple and safe procedures. So in summary, we've talked about lipomas and sebaceous cysts. A lipoma is a benign fatty tumor that grows under the skin. A sebaceous cyst is a sweat gland cyst that grows in the skin. If they bother you, if they've been infected, if they're causing pain or disfigurement, we can remove them. Many times we remove them in the office setting, and sometimes when they're large, we have to remove them in the operating room setting. Once again, Dr. Anthony Gonzalez, thank you for joining us for another important surgical topic.